Welcome to Connective Care Education. In this video, we are going to look at the content for Unit 003, Learning Outcome 11, Sensory Loss. Sensory loss is when one of the senses, for example, sight, hearing, smell, touch and taste, is not working as it should. The term is used primarily to describe sight loss, hearing loss and deaf-blindness. A sensory loss can affect individuals of any age. It may have been from birth or acquired at a later stage. Sensory loss in the form of loss of sight or hearing affects many older people. An individual does not have to fully lose a sense to be considered as having a sensory loss. Sensory losses will impact on the lives and needs of individuals in different ways. When an individual has a sensory loss, their mobility and ability to communicate are affected, and there is a risk of loneliness and isolation that can impact on their well-being. Causes and conditions of sensory loss. Sensory loss can be caused by a range of factors. Some affect just one area of the senses and some on both vision and hearing. Some of these are congenital, for example, the individual is born with them, and some acquired. So this happens during life due to an accident or illness. Examples of causes and conditions of sensory loss include trauma. An accident involving a head injury may impact on vision or hearing. Glaucoma, damage to the optic nerve by pressure of fluid in the eye. Cataracts, clouding of the lens in the eye leading to a loss of vision. Macular degeneration, usually age-related but affects the middle part of vision, can be linked to smoking, high blood pressure, being overweight and family history of macular degeneration. Diabetic retinopathy is a complication of diabetes caused by high blood sugars damaging the retina. It can cause blindness if left undiagnosed and untreated. Viral causes, for example, meningitis. Hereditary conditions. Industrial and noise-induced deafness. Meniere's disease, disorder of the inner ear, causes vertigo and hearing loss. Aging, this is the largest cause of sensory loss. Premature birth. Viruses during pregnancy, for example, rubella. Genetic conditions such as Usher syndrome. Usher syndrome is caused by gene mutation and the main symptoms are hearing loss and an eye condition called retinitis pigmentosa. Cerebral palsy. Many individuals with cerebral palsy also have sensory problems. Potential indicators and signs of sensory loss. Indicators and signs of sight loss. Holding reading materials further away or nearer than usual, not reacting to visual clues or signs, sitting too close to the television, bumping into or tripping over objects, moving around slowly, using walls as a guide, not seeing nearby objects, difficulty in determining floor level changes, discomfort with changes between light and dark, difficulty in seeing objects off to the side, white areas on the pupils, arises in changing colour, and complaining of seeing bright flashes of light. Indicators and signs of hearing loss. Failing to react to voices coming from behind, difficulty following and joining a group conversation, apparent inattention, using an excessively loud voice, continuously asking individuals to repeat what they've said, turning the television volume up, failing to respond to the doorbell or the telephone, giving inappropriate responses to questions and conversation, complaining of not being able to hear when there is a lot of background noise, and feeling tired or stressed from having to concentrate while listening. Factors that impact upon an individual with sensory loss. There are a range of factors that can impact on individuals with sensory loss, including impact on communication. Hearing loss can often be a hidden disability which can lead to problems with communicating with others and feelings of isolation for the individual concerned. They can struggle to use a telephone or hear the doorbell. This can make the individual feel frustrated. They can also find it difficult to watch TV or join in with group conversations, and this may cause them to withdraw into themselves. Individuals with sight loss are unable to recognise people and places, which can cause confusion and feelings of inadequacy and isolation. Impact on accessing information. Individuals with sight loss will be unable to read timetables, menus, signs, etc. Having to rely on another for this type of information can impact an individual's privacy and dignity. Similarly, an individual with hearing loss will struggle to access information that is not in print format and can feel a loss of privacy and dignity if not able to access their own information. Impact on routines. Individuals who lose their sight will feel increasingly separated from the world around them as their brain receives less stimulation. They can also feel less secure and can tend to avoid going out, which can further exacerbate their sense of isolation. Individuals with hearing loss may withdraw from social routines as they struggle to cope with following conversations in noisy surroundings. Both sight and hearing loss can affect an individual's mobility as they feel less able to move around their local area safely. Impact on attitudes. Individuals with sight or hearing loss can feel that society begins to treat them differently. Individuals with hearing loss feel that those around them stop including them in conversations and talk over them. The thoughtlessness of others can put individuals with sensory loss in harm's way. Hazards such as parked cars on pavements can cause risk of injury to individuals with sight loss as they will be expecting the pavement to be clear. Considerations when communicating with an individual with sight loss, hearing loss, deaf-blindness. Each individual with a sensory loss will have different needs and methods of communicating according to their individual loss. It is important to find out what these are and use them when communicating with individuals. There are, however, some general considerations that can be followed. Considerations when communicating with an individual with sight loss. Allow extra time. Stand in a place where you can be seen and touched for attention if necessary. Always identify yourself. Use names to identify individuals. Tell the individual you are leaving them, or if others are entering or leaving the room, don't just walk away. Don't use non-verbal communication such as pointing. When communicating in writing, use large printed words rather than joined up writing. Provide information in different formats, for example, email, large font, braille, audio tapes. Considerations when communicating with an individual with hearing loss. Allow extra time. Face the individual you are speaking to. Do not shout as this distorts the voice and lip patterns. Speak a little more slowly than usual. Stay in their field of vision. Use a loop system. Find out about their communication methods, for example, sign language. Use finger spelling or sign language. Speak at ear level. Repeat or rephrase if needed. Write things down. Make sure there is no echo in the room. Ask individuals to repeat important information back to you to make sure it's been understood. Make sure hearing aids are switched on and functioning. Considerations when communicating with an individual with deafblindness. Good lighting, plain background, stand in front of them. Individuals with deafblindness may communicate using tactile communication, using touch with objects, or tactual communication, using touch with individuals. Use clear speech and clear print. It might be useful to look at the deaf-blind manual alphabet to communicate using specialist communication support. The importance of supporting individuals to use aids such as hearing aids and glasses. Some individuals are reluctant or embarrassed to use aids such as glasses and hearing aids because they see them as a sign of disability or ageing. It is important that individuals are supported to use available aids to maximise remaining sight and hearing and enable them to manage in different environments. Wearing hearing aids and glasses supports an individual's independence, which in turn gives them dignity, positive self-esteem and a greater sense of well-being. Wearing glasses helps to minimise confusion about the environment and minimises trips and falls. Not wearing glasses increases eye strain, causes headaches and the inability to focus and double vision. The use of hearing aids enables individuals to concentrate better, participate more fully in work and social events and have better relationships with friends and family. The considerations when supporting an individual with loss of taste, smell or touch. Taste. Loss of taste may be a result of health disorders, medication or an age-related decrease in taste buds on the tongue. A loss of taste makes it more difficult to eat a balanced and nutritious diet. Loss of the experience of enjoying meals affects social interaction and can lead to depression. A nutritionist can create a menu or eating plan to help overcome the loss of the sense of taste and smell with different tastes and textures. Smell. Loss of smell can be caused by infection, changes in the brain or aging. Loss of smell also decreases an individual's appetite and makes it harder to notice hazards such as fires, gas leaks or out-of-date or spoilt foods. Smell ensures an individual maintains personal hygiene, but they may need additional support with this. For many, smell helps to evoke memories. Smoke and gas alarms enhance safety for those with a diminished sense of smell. Touch. A reduced sense of touch is as a result of illnesses and diseases reducing the blood flow to nerve endings. This makes it more difficult to detect pressure, temperature and texture, and in turn increases risks of falling and burns. Overall healthcare is important to individuals with no sense of touch as they may not feel injuries. Good foot care is important to those with a reduced sense of touch to stop the spread of infection. Care needs to be taken around hot objects and heat. Support available for individuals with sensory loss. There are a number of organisations that can offer advice and support for individuals suffering from sensory loss. General. For general support with sensory loss, please see the Centre of Excellence for Sensory Impairment. For sense support, please see the website. Hearing loss. Action on hearing loss can provide information for individuals who are deaf or have hearing loss, specialist employment support, home visits for individuals struggling with hearing loss, community-based hearing aid clinics, outreach support for individuals who are deaf with additional needs, and online skills training. Wales Council for Deaf People can facilitate support groups around Wales, provide training in sign language, sensory awareness and lip reading. Hearing Link Wales. They have a helpline which is manned by individuals who have experience of hearing loss, providing advice and information. Community support workers to provide personal and practical support and to run local community events. Sight loss. RNIB Cymru can offer courses on living with sight loss. They have a helpline giving advice of support available, talking book library, information on eye conditions, support to use assistive technology, Welsh language text-to-speech software. Sight Cymru offer rehabilitation and mobility, counselling, information, advice and advocacy, welfare rights assistance, clubs and activities, aids, equipment and resources specially designed for independence training, technology assistance, befriending and telephone support. Guide Dogs Cymru provides life-changing mobility services to adults. Wales Council for the Blind provides information on support and advice available across all areas of Wales. Deaf Blind Cymru provides information and advice, organises social groups and events, befriending service, assistive technology training and support, holiday caravans catering to individuals with sensory loss, provides independent living flats, care at home. Please complete the worksheet for Unit 003, Learning Outcome 11, Worksheet 1. Please submit all completed worksheets to your assessor and move on to the next video, Unit 003, Learning Outcome 12, Dementia. Thanks for watching.